Okay, welcome everybody. So excited to have my longtime friend and former colleague, Dr. Donna Baldwin here. She's one of my favorite doctors with whom I've had the pleasure of working in the past in various capacities at SiriusMD, and just a wonderful human being all around. So Donna, welcome.
Thank you. Thanks for having me.
So Donna, how about we just start with a quick overview of just a summary of your career trajectory?
Sure. So I am in Denver, Colorado, and so have spent my entire career here. After residency, I joined Kaiser Permanente here in Colorado, which is a large multi-specialty integrated network, as a continuity family medicine physician. And so really saw patients in the clinic. What was interesting is that we had an existing EMR back in 2003, and we transitioned over to Epic. And so I quickly became a super user. And so my first experiences were in digital health, actually. And so I was able to email my patients, do phone visits because I was salaried, not RVU based. And so got a taste of digital health very early on, and loved it. Really just wanted to be available to my patients when they needed me, and avoid, those long days that they would have to take off to come and see me if we really just needed to go over their labs or follow up on their depression medicine or anything like that. So had a very large women's health practice, pediatric practice, and really just a well-rounded continuity family practice. Probably 6 months into my career, I got a tap on the shoulder from one of our regional executive physicians and said, "Hey, your clinic needs a physician in charge. I think you'd be a good candidate." And I said, "Whoa, I'm just 6 months into my career. I'm not ready to do something like that." Plus I was, working with a bunch of seasoned physicians, and, it was quite intimidating being this young female physician who would walk in to meet a new patient and they would say, "Gosh, you're too young to be a doctor." And it really was a tough thing to swallow. And so initially I felt it as a kind of a not a compliment. And so I was talking with one of my to-be mentors, and she said, "No, Donna, that's a compliment. You take that in and then you go and say thank you, right? And don't perceive it as being something that's a negative." And so I did, and it changed my outlook. It changed the visit itself. It was really something that I needed, but I think it enabled me to get the confidence to take care of my patients. And only one patient said that wasn't a compliment, and it was this older gentleman, and I referred him to my older partner, male partner, down the hallway. So that's kind of how my career started. In a trajectory, I became a super user on Epic and was helping other physicians become more efficient. I helped teach a communication course to newly hired physicians, and really enjoyed my time there.
So when they said that we want you to be the, I don't know, physician lead, and as we get into this stuff, like, what did you think they meant? What did they actually mean in terms of skills you needed, the tactics you were going to actually implement, and so on? And looking back on that time, like your physician executive self, like, what advice would you give yourself in the very beginning as you're getting started?
Yeah, I mean, I think it's, for me, it's finding a mentor, right? Finding someone who's going to kind of help shepherd me through this process. I think about it like when my son was approaching kindergarten, and there's so many things that you have to learn to get your kid registered for kindergarten. And in fact, it starts almost a year before, right? And so I needed to lean on other parents to find out about, what are the steps to getting him registered. He had to go be tested, like all this stuff that I never even, realized was necessary. And so the same thing with my career. So looking for a mentor, really trying to find someone that I could trust, that would give me good sound advice, and that I could learn from. And so I think that was really important to me. And I found that it's not often something that physicians can find. And we need that help to navigate through those things.
So who was your mentor?
So first of all, it was my first one was the regional director, and basically I told him, I said, I'm not quite ready. Here's what I want between now and then. And so they had some coaching classes, some leadership training, and I said I really want to do that. I also said I really need more time to get to know the physicians, because there were seasoned physicians that I would be in charge of, right? That I'd be supervising. It was a clinic of around 12 family medicine, internal medicine, and pediatric physicians, and some had been there for a long time. So I said, I really need more help with that. And luckily he was very supportive. And I had meetings with him once a week. And then throughout my career, I had different mentors. For me, it was really important to have another female physician as a mentor, someone that was a mom that could kind of understand that. And then I had another family medicine chief that was also a mentor of mine. So, really leaned on those people to help guide me. And, for example, the female physician was in a leadership position. And she said, Donna, first of all, you're a wife first, you're a mom second, you're a physician third, and you're an administrator fourth. So as you make your decisions and as you try to find balance in your life, you really have to consider that as your guide in what you're doing. And so I think even to this day, I really think about that with the decisions that I'm making and the opportunities that I'm engaging with and deciding not to engage with.
So how did your career progress then after Kaiser?
Yeah, so I really fell in love with telehealth, and the group didn't want to support me committing most of my career to telehealth. So I left Kaiser in August of 2019, which was an interesting time to leave and go dive into digital health. And I met the amazing Dr. Moseni. So he was at CirrusMD as one of the medical directors and really one of the founding physicians for the provider network that we were building. So I was brought on, the only family medicine physician in a group of 13 ER docs, all of them guys, one of them a woman. So that was an interesting environment to be in. But really, I was brought on to really change from just an urgent care offering to our patients, but more of a virtual primary care offering. So I was the chief quality officer. So I built the quality program with Alex and was one of the medical directors, hired 50 docs, transformed the provider network to 60% primary care, 60% women and a third of color. So was really proud of that work. Over COVID, where we were super busy and had to scale our model and really be a leader in that company, fell in love with the sales and client success interactions. And so really created my own job. Our boss at the time said, what do you want to do, Donna? And, I was burning out in kind of the day-to-day operations stuff. And so really wanted to really focus more on the sales. So I wrote my own job description and he said, great, let's do it. Did that for a year and I felt really successful. We had a new CEO come in. Oh, by the way, Alex totally dumped me. And totally deserted me from CirrusMD. And so I will hold that to him to this day.
And came start working with me at the Orange Mothership. Yeah. Although when we got presentations from CirrusMD in demo mode, the first patient that they would use was called Alexander Moseni. Like I kept laughing every time they would do a CirrusMD demo. Let me quickly ask about quality. So a lot of folks are doing something related to quality, whether it's hospital quality committees or health plans and providers doing stuff around HEDIS. On the delivery of virtual care, there's other aspects to quality, right? There's the training and the compliance and the oversight and reviewing charts and so on. Can you walk us through a little bit, educate our folks around what was there in place back in 2020 or 19 when you were getting started, and what is there now? Because these things have really evolved in the last kind of 4 or 5 years.
Yeah, I think you're right. So Alex actually, he had a skeleton, right? He had a quality process where we did peer-to-peer reviews. And so he started that. There's also a lot of compliance related quality things. And so it's really interesting to kind of balance that out. For example, we were a chat-based model. And so 96% of all of our interactions were back and forth text messages, let's say, on our platform. And so there's not all states recognize those as bona fide patient-physician relationships. And so we had to have a 50-state review done with our legal team to figure out what states we needed to do a video or what states we needed to do a phone visit in order to establish that relationship. And so, that was one piece of compliance that we had to work on. We also wanted to really beef up our best practices. And so we wanted our physicians to be practicing in a high quality evidence-based manner. And so we established over 50 best practices from, acute care to chronic disease to prevention that our physicians were attesting to using, so that we helped really not only streamline our care, but really enable our patients to have the same experience, whether they were talking to Alex or they were talking to me. And then, again, the peer-to-peer review process. We also had to establish some peer review committees to really kind of review and maintain our ability to evaluate our physicians. And then we had a professional review committee as well. I will say that I think that I had one experience in my career that was very unique and outstanding. I sat on the Colorado Medical Board for 8 years. I was their past president. It's an appointed volunteer position, so the governor will appoint you to do so. You have to apply. But that gained a lot of expertise and experience in the medical legal world, which I think really helped me have that lens of ensuring quality and avoiding risk.
I want to add a few comments. As you were talking, Donna, I was thinking to myself, like, what are the different buckets of quality work? Like, why do we even do quality, right? And as you were talking, I realized there's a couple buckets. One is, like, as you said, there's a compliance component to it, right? Making sure that every encounter is meeting whatever the compliance requirements are, like state-specific licensing, et cetera. Then there's another piece, which is making sure that the medicine follows like best evidence-based, guidelines or whatever. There's that piece. And there's another bucket, which I think is really interesting and was important for us, and so I want to share with Reza, which is a lot of times in healthcare, when you're measuring one thing, you have to measure it against some opposing force, right? So in emergency medicine, my specialty, and in this telehealth model, there is definitely a lot of pressure to see patients quickly. We were very proud of the fact that when patients would come on, we would, our average, door to doctor time, which is like from the moment that the patient texts until the first response to them, was sub 30 seconds, right? Like unbelievable. But in order to maintain that, that means you had to be handling all of your existing cases very quickly. So what happens if you handle cases too quickly? Well, the quality of the engagement falls off, right? You're not asking good questions. You're not really absorbing what the patient is saying. You're being maybe a little bit short with them or whatever. And this is a different form of quality. You may have still practiced evidence-based medicine, right? You may have still did everything you did from a compliance perspective, but the patient satisfaction piece of quality maybe fell off, right? So that piece of it was an important part too.
Okay.
No, I said, which led us to really kind of formalize our patient complaint process, right? So we wanted to hear feedback from patients. We wanted to know where our blinders were. And so set up a process by which patients could leave a voicemail or send an email, and then we could respond to that appropriately. Sometimes it was, Dr. Maseni didn't give me antibiotics for my 3 days of a cough, which, was probably the most common complaint, or Dr. Baldwin wouldn't treat my pyelonephritis on chat. She made me go in. So, but it still enabled us to, find what most patients complain about. What's the number one thing people complain about is communication. And so we were able to then be able to work with our physicians and help them, how do you demonstrate empathy on a chat, right? And so that really would enhance our quality as well and reduces your risk, right? Nobody wants a word complaint because you didn't communicate effectively.
Yeah, a couple of themes I want to pull on. One is this idea that, we have mentors who guide us through a process, right? Like, and sometimes our mentors have worked in more traditional settings, right? Hospitals and outpatient settings and so on, and they're executives with a lot of experience. So with this whole movement to telehealth and digital care and high acuity care in the home, some of those things translate, and some of those things you have to come up with new processes. So walk us through, as a physician leader, how much of the playbook did you have to kind of create as you went along? And then how would you kind of judge, this whole idea, we all have some amount of imposter syndrome. Like, am I doing the right thing in this new innovative space? And what the feedback loops of that?
Yeah, I mean, I think it really starts with hiring the right people, right? And so, we would interview physicians really looking for that fit, right? Because we don't want them to be miserable. Because if they're not happy in the fit, then it's not going to work out. For example, we hired a great family medicine physician, and she was wonderful, but she didn't like the communication, the amount of communication that our group had, and so she said, I just don't like all the feedback." And so, we were a group that, gave each other tons of feedback. We were on text streams together when we were working. We collaborated on patients, and she hated it. And so it just wasn't a good fit for her. So I think you have to get the right people on the bus, right? And then you have to have them willing to want to evolve and change. We engaged other people to get their ideas so when we were building best practices, it wasn't me writing them all, right? It was engaging the group to say, hey, who has passion around dental abscesses and wants to write a best practice about that? And I think, getting input from our client success team, our sales team around, how can we better serve our patients? So I think it's being inclusive of as many people as you can to be able to pivot and really do what's right for patient care, because the patients are truly at that center.
I want to touch on one more, I think, important thing that I've seen get missed in virtual care so often, and something Donna did really well, which is when you are servicing a very large population at scale, so tens of thousands, if not hundreds of thousands of encounters, you will have bad outcomes. Whether or not you practice medicine, irrespective of practicing medicine perfectly, there will be bad outcomes, there will be complaints, there will be potential med mal cases, right? Like, there will be investigations. So it is of utmost importance to take a proactive approach to all that. And that's something that I feel like a lot of new virtual health startups are missing. They don't understand that this complication that only happens 1 in 1,000 patients, like, that's going to happen. That's like, if you're seeing 10,000 patients, you're going to see it 10 times, And for some people, that doesn't click until it's too late.
Yeah. I think in my journey, I think that when you're delivering healthcare in whatever company, whether it's brick and mortar or whether it's virtual care, I think that where I see them fail is they have very strong CEO, they have very strong product people, but they do not have a strong clinical strategist with them. And that's where they fail, because then they start going after this shiny object and they forget that they're delivering healthcare. And so if you're not listening to the patients that you're seeing and you're not listening to the clinicians that are actually providing the service, then you're really not going to get anywhere. You might be able to sell a product, but maybe they're not actually doing that, right? Or the patients aren't actually asking for that. And that's really where I think is where us as clinicians can be really important. And we have to be strong, right? You have to be able to feel like you can speak up in an environment. You have to feel like you're being listened to. Otherwise, for me, that's not going to be a match.
You mentioned that you eventually got into commercialization. So walk us through that. What did you think was going to happen? What kind of skills did you have going into it? And then what were the additional things that were required that you kind of learned on the job?
Sure. So SiriusMD had a great coach. So he was able to walk us through a pitch and what are the things that you need to be thinking about. So I got some initial training in, sales and how to deliver a pitch. And then that was super helpful. I listened to a lot of the salespeople giving their pitch. I think where and Alex has experience too, when you have a meeting where you have a CMO at the table or you have a clinician at the table that's helping to make the decision, if you don't have another clinician at the table, you're going to meet with a lot of resistance. I also was involved in a deal that the administration was not bringing in the med group. They were going to make a decision without the med group. And I said, ooh, that's a really bad idea, because you're not going to be able to arm wrestle physicians. Like, they will make your life completely miserable. And so I think that it was really important that when I was brought in, or Alex was brought in on meetings, we made a huge impact, right? Because you have that initial paternalization with that physician, and there's that trust that immediately exists. And so when there was a question from the CMO, like, I don't understand how that works. Patients aren't going to really like chatting. They're going to want to see you. I can actually say, well, I was actually seeing a patient yesterday, and she said she would have never talked to me over the phone. She would have never wanted to she was too embarrassed to do a video. So this was the only way she was going to seek help. And he's like, oh, okay. And he believed me right there. Whereas you can't get that from a salesperson, right? So I think that for physicians are incredibly impactful. And so I got that feedback tons from my sales team and client success team. I could diffuse something so quickly where they were really struggling.
Yeah, I agree 1,000%. Like, I've done some of this commercialization, and I still do. And being a credible partner with these companies, I feel like a lot of our early stage physician leaders can really engage in this aspect of it. Because if they like a product, they're already using it, they can, provide a testimonial. They don't need to be, professional salesmen and women. They're there to provide relevance, credibility, and testimonials.
Yep.
I think this is actually a fascinating thread for us to expand on in the future, Reza, because I don't hear people talking about this much. The role of the physician on the sales and growth team, because we have seen some really bad physicians play, like we've seen physicians totally ruin the deal, and we've seen physicians totally save the deal, right? So what are the differences? What are the lessons learned? I think that's a fascinating topic for us to deep dive on at some point. That is amazing. So Donna, talk to us a little bit about what you're doing now.
Yeah, so I left SiriusMD about a year ago. I stayed doing some clinical stuff, which I'm not doing anymore for them. So I started, I met this guy, Dr. Moseni, who said, hey, you're a 50 state licensed doc. I got these PCA owner opportunities. I want to get you engaged. He's actually been bugging me about it for probably 4 years. And so finally, about a year ago, I said, all right, Alex, talk me through this. What do you got? And he started sending me things that I was better suited for, women's health stuff, fertility stuff, mental health, stuff that was more primary care oriented, that he didn't want to deal with. And so that's how I started. So thank you, Alex. So I have 3 PC owner companies that I work with right now. And I have probably spoken with, 30 or 40. And so it's taken me this long to find the right fit from both sides. There are some companies where I don't want to take that risk. And so really understanding for me, what kind of company do I want to work with? And I want to be passionate about it. I also want to be able to engage in it. And so I'm not going to be one of those PC owners where I'm just signing off on things. I actually want to provide and help them with their clinical strategy. I'm happy to sit in a sales meeting with them, right? To be that clinical voice. I'm working with one company and setting their quality program up. So, it can vary based on what they need and what my skill set is, but that part of it's fun. I'm also a collaborating physician. So I work with a couple of different companies locally and in person, as well as virtually across the country, some big companies and some little companies, where I'm a collaborating physician for nurse practitioners and PAs, which means, monthly meetings where I hold office hours where they come on and ask questions. I give them feedback. We talk about a clinical case. I do chart reviews based on the state requirements. And then they can text or call me if they have a question or want me to look at an EKG or a chest x-ray with them. And so that's kind of fun. It really taps into that kind of teaching and collaborating, but it also helps me hone my skills, right? So, I don't know what to do with 13-year-old with an STI? What are the regulations in that state? And so it really helps me kind of dive into, what causes sinus bradycardia in a 28-year-old guy? Like, what should we do? So, I really feel like it's helping me stay relevant. And then I'm seeing patients in urgent care, and I'm also doing a little bit of teaching at the local medical school. So kind of sounds like a lot, but it actually ends up being maybe 10 or 15 hours a week. So it's a great work-life balance. But and then continuing to still talk about with other companies about their needs with the fractional CMO. I'm consulting with another company. They have a CMO and a PC owner, but they're new in that digital health space and building. And so I'm working as a consultant for them to help them.
Let's dive in a little bit more into the collaborating physician piece. I know for some of our students, that's probably an easy place to get started. And maybe they're already doing some of this in some capacity. One of the concerns I had when, I had a leadership role at an entity that was doing, 400,000 visits a year doing with nurse practitioners, was not the calls that we would get, was the calls that we would not get. So, walk me through how you think about being proactive to make sure that if there is a questionable EKG, let's say, right, that they're contacting you more often instead of less often. How do you think about these, and how have you kind of advise other companies in the space or other physicians in the space?
Yeah, I mean, I think it's about building that effective working relationship, right? So it's being able to, meet them, ask them about their lives, building that relationship, and then being available. Like, I'm available, text me, if I don't text you right back, call me, or it's about being available and being comfortable. I'm also one that I don't hold back feedback, whether it's positive or whether it's constructive, right? And so with the sinus bradycardia guy, the PA sent me the note just to sign off on it, and I said, well, time out, like, why are you just getting an echo? Like, I think this guy probably needs a Holter or cardiology evaluation to figure out what the sinus bradycardia means. I mean, it was like 46, so I mean, it was pretty significant. And so I said, certainly, it could be an MI, certainly it could be, an SA node slowing. So, let's dig a little bit deeper. And so he was like, thank you so much for that feedback. And I think oftentimes their collaborating physicians are not giving any feedback, whether it's like, nice catch, good job, what are you thinking, versus me just spewing my advice. So I think it's really about building that relationship and that comfortableness so that they feel like they're being supported and that they're comfortable coming to me with anything.
Donna, how did you get your first collaborating physician opportunity, and how are you sourcing these?
LinkedIn.
Oh, through LinkedIn. Meaning,
so LinkedIn.
Did the NP reach out to you directly, or what?
No, so I am doing some work for Carbon Health, which is, they have urgent cares that are all over the country, but here in Colorado, and they just had a posting. And so I linked in, and then I followed up with a recruiter, and and I had applied for a job with another company, and I didn't really want to do I didn't want to be on their platform practicing. And then I saw that they had a collaborating physician. And so I reached out to that same recruiter and just said, hey, remember me? Yeah, I'd love to apply for this job. But LinkedIn's a great resource.
Yeah.
And you can actually filter to find new collaborating physician roles.
Interesting. And then how does the MedMal work in that role?
They pay for it.
They pay for it.
Yeah. In all of my engagements, that's a requirement. Yeah. And so, that they pay for my medical malpractice. I've got some pushback on that where they want me to provide it. And I say that's not standard. And so they figure it out. I mean, most of the time they have to have MedMal for their other clinicians, so they can just add me to their policy.
Are there any kind of lessons learned, red flags, or anything now that you've done it for a while?
As far as collaborating? Not really. I mean, I think that I can't really think of any. Every system is a little bit different, and they're not all straightforward. So trying to get on Epic to just do chart reviews was hugely challenging. They didn't have great support for that. And I think you have to find, it's sometimes often hard because if you're working with a large company, you're not really working with another physician at all, right? You're not being hired by another physician, you're being hired by a recruiter. And so I think you have to find who that physician support is. So you can ask, how do you do your monthly review? You know, how do you schedule them, and how do you do them, and what kinds of feedback do you give? And so just some of the logistical stuff, I think it's important to have a physician in that role to, again, kind of help mentor you through.
Talk to me a little bit about like life and career satisfaction for you today compared to how it was when you just had one role as, you know, at Kaiser. How did that, you know, how's your life changed?
It's huge. You know, my husband even remarks how much happier I am being able to do that. I feel more in charge and in control of what I want to do and what I don't want to do. So really, I'm my own boss. I think you have to be super organized, and I'm a super organized person to a fault. And so, you know, we just did our taxes, which was a nightmare, right? With all these 1099s, and did we do enough quarterly, you know, contributions, and how much is this going to be, and how do you, you know, we set up an LLC, and so how does that work with our personal finances? And so, you know, get a good accountant to be able to walk you through what's the best. You know, do you have a partnership LLC, or do you have, you know, a C corporation? So it's those kind of things. I think you need that financial help, and then I just keep really good spreadsheets to be able to understand, because, you know, I have to have a budget, right? I have to have a baseline salary in order to support my family and support myself and support my golf game and my travel and all that. So, you know, oftentimes, you know, if they're gigs that are more consultant, then that gets tough. So I really try to have a retainer. So like, for example, with this group that I'm just consulting with, I said, I prefer for you to have a retainer. So how many hours you want of me, I want you to pay that regularly. And then anything over, we can do it at this rate, because that gives me some at least planned finance, right? And I think that's important. But, you know, keeping a spreadsheet of all the nurse practitioners I'm collaborating with, because there's a max in some states, there's not a max in other states. And so just being really organized and making sure you're getting paid right. There was a company that wasn't paying me right. And so I wouldn't have known that if I hadn't kept track of it.
For sure. That's happened so many times to me. So tell me, what proportion of your deals are coming through your network and your connections versus somehow kind of, I don't know, seeing a job listing or searching for a job opportunity? And how are you expanding like your network and your connections?
Sure. So there was this networking group called Ask the Hive that that was really helpful in meeting people. And then Dr. Maseni took it down. So that was one way that I was meeting a lot of people and networking. I think that I've been introduced to a few attorneys that have also been really helpful, because they're attorneys that do PC owner deals. And so they'll then recommend me to different companies. You know, other people in this space have been really helpful, like you. And so for the PC owner stuff, I've been approached through my LinkedIn profile. So I think honing your LinkedIn profile to say that you're a fractional CMO or you're your 50 state license gets attention. I generally don't say no to any contact in LinkedIn. So I have a very large network, a very large LinkedIn network. And I take any meeting. Like I'll talk to anybody because who knows what it'll turn into. And so most of my collaborating roles came from LinkedIn and not necessarily from my network. But the PC owner, I would say, I would say 80%. 80% came from networking, 20% came from people finding me on LinkedIn. I also have two other groups that I connected to. So there's a fractional jobs group on LinkedIn, and then they send I don't know if it's twice a week or once a week. Right now, there's no physician jobs on it, but I've talked with them, and they're on the lookout for that. But that enables me to then share it with other people that are non-physicians, and then they share their stuff back with me. So I'm talking with the group tomorrow that I got from one of my past CRSMD folks that are looking for a fractional CMO, and so they're connecting me. And so, so yes, I think networking is very important, and I am honored to be able to pass along things to other people as well. So I've got a couple of people that are got some locum stuff or some other fractional stuff because it wasn't a good fit for me, but it was for them. And so I also truly believe that we don't need to be in competition with each other, right? That's gone. Medical school residency is over. There's plenty of jobs and there's plenty of work. And so women, I think, are the worst about wanting to be competitive with each other, especially women in healthcare, because they've had to do it for so long, especially in executive roles. And so they tend to not want to build each other up and help each other. And so that's my legacy, is really being able to find and work with other women executives, women healthcare executives that really want to get more into this space, because I think that it's sometimes a rough world out there for us.
Well, Donna, thank you. I have one last question as we wrap up. This idea of having bandwidth to take the low yield meetings, right? Like some folks who have a full-time, like 9-to-5 job, find it difficult to create bandwidth to be available. So how do you balance that at this point or earlier? Or what advice do you have for folks to, what can be done to create some space in which you can have that additional touch points, even if they don't pan out, in the first 10 conversations?
Yeah, I mean, I think, Alex introduced me to one company and I didn't ask enough questions, and I should have. And I should have done more research on the company because it was one that I was totally not interested in. It was too much risk, didn't want to get into that space. And I scheduled the meeting, but then I canceled, which I felt bad about. But I think asking questions of where you're, trying to do your homework on the company, right? If they're not on LinkedIn, if they're not on the web, trying to dig a little bit. Most of these companies are very flexible at their time. So whether it's a weekend or an evening, they're happy to have a meeting whenever, and work around your schedule. So I think it's prioritizing too, right? If it's something that you want, you have to make the time and put it as a priority.
I want to add something here. I think you hit the nail on the head here, Donna. You got to realize the people who are reaching out looking for like a fractional CMO or EC owner or collaborating physician, a lot of founders are working at quote unquote founder speed. They're trying to solve this problem and they want to solve it today if they can, So when they reach out, if you can somehow find a way to get on the phone with them immediately, I would say you're 10x more likely to get the deal. That is what I have found in my career. So when I get these outreaches, I'll say, here's my Calendly, but here's my cell phone, and you can call me directly. I'm free until like 9 p.m. tonight. Just call me. And I can't even tell you how many of my deals came from that sort of phone call.
Mm-hmm. Absolutely. And I think it's really hard to take the leap, right? When you have that one job that you're getting a salary from and you want to break away from that, you're like, where am I going to get my health care? Am I going to really have enough income? Take the leap. As physicians, there's so many opportunities for us, and things in my experience, they've always worked out whenever I've taken that leap. And that's the hardest part, is to say, I'm breaking away. I'm ripping the Band-Aid off. I'm just going to do it. And I look back and Alex looks back, all worked out, and I'm making more money than I ever have.
Amazing. Donna, again, you are one of my favorite doctors, one of my favorite human beings. Thank you so much. This was really amazing to hear your story.
Thank you. Thanks for letting me share it.